Hi, I'm Glenn Jaffe, and I'm a vitreoretina specialist. I work at the Duke Eye Center. I take care of patients who have problems with the back of the eye, for example, the retina, and I do medical treatments and surgical treatments depending on what the person's problem is. There's lots of things that I enjoy about the patients and lots of things that I enjoy about the work that I do here at Duke. The patients come from a variety of different backgrounds, and I find that I may be learning as much from them as they may be from me through the various conversations that I have with them. Everybody has a different story, and it's just really interesting to learn all about the patients that I take care of. When somebody comes to see me, I want to get to know them and their history so that I'm tailoring the treatment for that particular person. I'm involved in a variety of types of research, but there are a couple things that I've been involved with that have directly impacted patient care. And one of these is the development of intraocular sustained drug delivery systems. These are small systems that can release medication over long periods of time to avoid patients having to take toxic medications or to get painful injections. There was a patient that was at Johns Hopkins who had had inflammation in the eye, and they had been given more than 100 injections inside their eye to try and control their inflammation. And despite this, the patient's vision was declining. And so my friend and colleague who had been treating this patient asked if it might be possible to place one of these delivery systems that we had been working on into this patient's eye. And meanwhile, the patient's vision had declined to a level where after she delivered her son, which happened during this decline in vision, she was not able to see his face. And after he was born, didn't know what he looked like. So she came to Duke, and we were able to get approval from the regulatory agencies at Duke and also from the FDA to place one of these implants once we were convinced that it was safe to do so. And her vision started improving, and it improved to the point where for the first time she was able to see her son's face. There are lots of reasons to come to Duke. The physicians that are on the faculty, I think, as a group, are exceedingly capable, and they're very highly trained. They're also very compassionate and caring, and they put the welfare of the patient as of utmost importance.